The debate has been loud and divisive.
We need a public option.
Just say no! I have a question for you.
In the end, of course, that controversial health care bill passed. Still, there's no shortage of dilemmas like this one at a small pharmacy in New Jersey.
It'll be $140.
$140?
Yeah.
But that's not possible. I'm sure there's a mistake.
But there is no mistake. A drug she needs to survive is no longer covered by her insurance.
You have to pay the full price.
But I have $20. You don't understand. I'm at the end of my Social Security.
Universal healthcare systems assist, either partially or fully, with health coverage for a country's citizens. Universal healthcare systems appeared in their earliest forms in 18th century Europe in order to facilitate income stabilization and protection against the wage loss of sickness. There was some push for American healthcare reform in the early 1900s, but that came to a halt during the Red Scare post-World War I as people associated it with communism. Currently, the United States is the only first world country that does not have a universal care system, though Obamacare, which deals with patient protection and insurance rights, is often mistaken for one. The government-run health payment programs that are currently in place are Medicare, a federal health insurance program for the elderly, and Medicaid, a program for those in need of financial support. In recent years, there has been controversy in the United States as to whether or not it would be beneficial to move to a universal healthcare system. Personally, I think it would because it would not only save lives, but also stimulate the economy.
And sometimes you have a woman lying in bed, looking you straight in the eye, without saying a word, but asking a very powerful question. I have a condition which I know in other parts of the world could be treated. But because I'm here and I'm poor, this condition may be a death sentence.
People, of course, lose their lives everywhere. But in the United States, treatment is so expensive, patients can be forced to forego it, even if their condition is known to be curable. According to a 2011 study, the U.S. has the highest amenable mortality rates among the world's 16 most highly developed countries. While on average, the other countries studied experienced 65 preventable deaths per 100,000, the United States has 96 per 100,000. The factor that sets the U.S. apart is that it is the only country studied without a universal care system in place, exhibiting a correlation that is needlessly costing patients their lives.
This brings us to the cost of healthcare. Good news, Americans, we're number one. Well, actually, it's not that great. In 2012, the U.S. on average spent $8,745 per person on healthcare. Other rich countries like Switzerland and Norway spent a little over $6,000, and countries like Germany, France, the UK, and Japan spent in the $3,000 to $5,000 range. So the US is spending twice as much per person as most other developed countries. Put another way, the US spends the same share of GDP just on Medicare as most countries spend to cover their entire population.
This proves that the US is spending too much money on a healthcare system that, as was previously discussed, is not as effective as it should be. But it's not just the government that's losing money, it's also business. According to Dr. Bazad Mohit, with a universal healthcare system, companies would keep that money and would have a healthier and more productive workforce. If the United States moves to a universal care plan, the government will have more money to put towards other endeavors, and companies will have more to recycle back into the economy. While it's still a controversial issue, in light of the lives and money it would save, I do believe the United States would benefit from moving to a universal healthcare system.